So I wanted to briefly introduce the panelists and the programs or the initiatives they are leading. So I start with Paulo Bonilla. He's the National Coordinator of Children's Health and Breastfeeding at the Ministry of Health of Brazil. And he will be telling us about some pilot initiatives of the Ministry of Health with the mayor of Fortaleza in Sao Paulo and also in the Amazonia. These are initiatives on, he will talk about that, DPI, Desenvolvimiento per la Primera Infancia, mainly focusing on psychostimulation via home visits. Then we have Andrea Torres. She is the current director of the Chile Crece Contigo strategy. I'm sure most of you know this strategy, this Chilean strategy that has been the example, the pioneer, the leading strategy in our region because of its multi-sectoral approach to improve child and maternal outcomes. And it has been sitting on the Ministry of Health at its inception in 2006, but now Andrea is directing this from the Ministerio de Desarrollo Social. And then we have Liese Gómez Serpa. She's the current director of PIM, the Programa Infancia Melior, who is also a program of home visits, who is based on the Ministry of Health of Rio Grande do Sul, but it is coordinated with the Ministerio de Educación, de Derecho, de Justicia, etc. It's an intersectoral approach to child development, and it has been built upon the Educa tu Hijo program from Cuba, and also inspired by the Nurse Family Partnership. But they have done a great work on adapting the program to the local context, but also to some vulnerable populations, like the indigenous populations, and also women in prisons, and she's going to focus a little bit on that. The structure of this panel is more of a discussion panel, as opposed to the panel we already have, the WOSMOS presentation, but still I want to give each of them 10 minutes to present very briefly anything I might have missed from their programs, and to focus on questions that will show up here, 5 questions that are the ones that we want to cover in this panel. The first is about any lessons, challenges on scaling up a program. That could be political traction, that could be anything that help programs to be scaled up and sustained. Because we have 2 programs that have been in existence for about 10 years, the PIM and the Chile Crece Contigo. Then the second is about maintaining quality at scale. This has been coming up through the morning sessions, and I wanted them to talk about the processes to set quality standards and the processes to monitor quality standards during the implementation. The third one is about information systems for monitoring and evaluation. We know that best practices tell us that scale-up should be data-driven, so I would like to know whether data, evidence, or evaluations have been used to drive the implementation in their experiences. And very important, whether there is any continuous quality improvement system that is being used, any feedback loops between beneficiaries and providers that helps to assess, first, how the implementation is going, and second, to monitor and improve the implementation. The fourth is about decentralization and local capacity. Again, training and supervision supports in the local level has come up as one of the important issues when one wants to scale a program, and whether there is any gap between what is needed at the local level and what is available in terms of infrastructure and resources. We might need 10 agentes comunitarios de salud tomorrow in this little village, but there are 5. So how do we go about it? Or we might need literate supervisors or a high school level supervisors, but they are not there. So how do we deal with these local issues in the short run and in the long run as well? And then the last but not the least is how to approach culturally and ethnically diverse contexts. So how has been the experience of them making changes and adaptations to fit culturally and ethnically diverse contexts? So I think I'm going to leave them to talk for about 10, 12 minutes, one of them, and then we can open to the floor because I'm sure you will have a lot of questions for them. Thank you.